Okay, so this is our presentation on our introduction. So the name of our article is Effects of Physiological Arousal on Speech Motor Control and Speech Motor Practice in Preschool Age Children Who Do and Do Not Stutter.
Okay, so our overview of our article is that we examine the effects of physiological arousal on speech motor control and speech motor practice effects in preschool age children who do and who do not stutter. So how this was done was taking 18 children who do stutter and 18 age and gender matched children who do not stutter, and they had the participants repeat a phrase, "Buy Bobby a puppy." And by looking at this phrase, they read the participants' lip movements using an octotrack system. And the spatiotemporal index and mean utterance duration were calculated to examine speech motor control and the speech motor practice effects in these children. So this is the evaluation checklist that we followed. There were 6 evaluation items, and we're going to go through each in detail based on our article. So the first item we have is a clear statement of the general problem was given. So in the article, in the introduction, it says, despite the possibility that emotional processes are thought to contribute to childhood stuttering, the effects of emotion on speech motor control in young children who do and who do not stutter have not been studied to date. The purpose of the study was to investigate potential effects of emotional processes on speech motor control and speech motor practice effects in preschool age children with stutter and children with no stutter. So the problem that's being researched in this article is how the effects of emotion on young children who do and who do not stutter affects their speech motor control and speech motor practice. The next, we looked at if there was a logical and convincing rationale. So there's currently minimal research reporting on whether the emotional elicitation conditions did elicit increased arousal in the participants. And the current existing research that we do know is inconclusive and only limited to adults. So it makes sense, it's logical that we would be looking at and researching this information in relation to children because we only have information and research on adults, and it's inconclusive. So the article states that this study was carried out to address this gap in knowledge and examine the effects of physiological arousal on speech motor control and speech motor practice effects. The latter is defined as the immediate improvement in speech motor control as a result of practice in preschool age children with stutter and children without no stutter. And looking at the literature review, we have knowledge through past research of when stuttering emerges. So it helps us predict what age we should study in this research article. And variations in speech motor control in stressful speaking situations have been reported in both normally fluent and stuttering adults. So it's important that we look at these variations now in children. So the author reviews articles that are all very relevant to this topic and leads up to the main research questions. Although we have knowledge of when stuttering emerges, there's minimal research on whether children with stutter differ in speech motor practice effects compared to children with no stutter. The author shows how prior research, although helpful, does lead to gaps in literature.
Okay, so next, the introduction did do a good job in conveying how evidence from different articles led to the questions and the purpose of this article. Some of the important facts that led to the framing of this article include: 1, variations in speech, motor control, and stressful speaking situations have been reported in both normally fluent and stuttering adults, with the latter group showing greater effective stress on speech than the former. 2nd, the effect of stress on speech motor control may be more pronounced in children, given that their speech motor control and emotional regulatory processes are less developed than those of adults. 3, clinically, there are numerous reports of increased disfluency in stuttering children when they experience emotional arousal, even when it is positive in nature. 4, brain regions involved in motor control, including the motor cortex, cerebellum, and basal ganglia, have a high number of stress hormone receptors, which makes them particularly susceptible to the effects of stress. So, based on evidence, including that from neuroscience and disciplines outside of speech and communication disorders, the article points out that there is evidence to suggest that psychological arousal can disrupt speech motor control. However, there is inconsistent findings of the association between emotional arousal and speech articulation in children who stutter and children who do not stutter, thus leading to the purpose of this article. So the introduction was clearly written and well organized, and this is proven by the manner and order in which the information was provided. So first, the introduction states a straightforward general problem statement, which is, despite the possibility that emotional processes, i.e. emotional reactivity and regulation, are thought to contribute to childhood stuttering, the effects of emotion on speech motor control in young children who do stutter and do not stutter have been studied to date. Next, the problem statement is justified by rationale that is supported by research literature, and these references are adequate and fit into the research being conducted. This is an example. To our knowledge, only one study examined the effect of emotion on speech rate in preschool age children who do stutter and children who do not stutter. In that study, the articulatory rate during a narrative was examined in 3 groups of preschool age participants. Those preschool age CWS who subsequently developed chronic stuttering, those CWS who subsequently recovered from stuttering, and their peers who did not stutter. Despite there being research that associates arousal and speech motor control, the article highlights that the findings were inconclusive, partly because of the approach taken. It specifically states, few studies have objectively assessed or reported whether the emotion elicitation conditions did, in fact, elicit increased arousal in the participants. Furthermore, the article recognizes the gaps and states how all previous research has led to the research questions. And the research questions are: 1, do preschool age children who stutter have greater articulatory movement variability than children who do not stutter overall and under emotionally arousing conditions? 2, do preschool age children who stutter have long utterance duration than children who do not stutter overall and under emotionally arousing conditions? And 3, do preschool age children who stutter have a lesser speech motor practice effect than children who do not stutter overall and under emotionally arousing conditions? So our overall rating was good for the introduction. So this introduction gives the reader information on what we know through previous studies and what still has to be researched. Although there are many individual aspects that may contribute to the onset of stuttering, this article wants to see how one aspect may affect the other. This is made possible through gathering information of children who stutter as well as children who do not stutter to see the effects of emotion on speech motor control.
Yep. Okay, so that's the end of our presentation, and we look forward to continuing to read and gather more information from this article.